Healthcare systems are currently facing an administrative workload that is physically impossible to complete within standard shift hours. The industry calls the result pajama time, the hours physicians spend typing up electronic health records at home, long after the clinic has closed. This map shows the human cost of that cognitive overload. These red nodes represent the estimated 40 million patients affected by diagnostic errors annually. The root of the crisis is biological. Human cognition cannot manually process the volume of complex data produced in a modern clinic within a 15-minute appointment window. However, medical AI has moved from the laboratory into active hospital operation. The U.S. Food and Drug Administration has already cleared more than 200 distinct AI algorithms for the cardiology sector alone. This combination of heavy financial investment and rapid clinical adoption marks a permanent change in the global standard of medical care. The first step of the modern patient encounter begins by removing the keyboard from the exam room. This schematic illustrates the mechanics of ambient AI scribing. These tools listen to the natural conversation between a doctor and patient and instantly structure the dialogue into formal medical notes. We can see this in the enterprise-wide rollout at Vanderbilt University Medical Center, where ambient scribing was provided to thousands of clinicians simultaneously. The results showed an average of 6 minutes saved per patient encounter and a 65% reduction in clinician fatigue. By shifting the workflow from manual typing to simply reviewing an AI-generated draft, the physician can return their visual and mental focus directly to the patient. If the consultation requires further investigation, the encounter moves to the imaging lab. In the lab, multimodal foundation models process textual clinical notes and visual pixel data, such as this brain scan, simultaneously. These models act as an autonomous second reader, drafting radiology reports to help clear diagnostic bottlenecks. But a significant barrier to trust remains: the risk of hallucinations, where a model invents findings not actually found in the pixel data. The technological fix is fact-aware retrieval-augmented generation. This logic chart shows how the AI is blocked by a verification filter until its findings are matched against a database of verified historical records. Grounding generative AI in factual retrieved data is a necessary engineering requirement to make autonomous medical imaging safe for patients. Once the diagnosis is clear, AI transitions from analysis to actively modifying treatment strategies. The DECIDE registry is a study of 20,000 patients evaluating the impact of AI-enabled coronary plaque analysis. Comparing standard scans against the AI-enabled pathway, AI plaque analysis changed medical management in over half of symptomatic patients. The result, an average LDL cholesterol drop of 18.7 milligrams per deciliter and a 15% decrease in cardiac event risk. These findings suggest that AI quantification moves cardiovascular care beyond simple observation. By identifying high-risk markers that standard scans miss, these models act as a driver for precision medicine. Despite these capabilities, the jagged frontier of clinical AI shows that deploying models into a hospital is much more difficult than testing them in a laboratory. Because of these risks, the World Health Organization has issued guidance calling for strict ethical oversight and accountability frameworks. To prevent automation bias, the interaction must be designed so the AI is invisible, rather than adding more administrative clicks to a doctor's day. Trials conducted throughout 2026 indicate that human plus AI systems consistently outperform physicians working alone. Mastering this human-centric workflow design is just as critical to patient safety as the accuracy of the underlying algorithm. At its core, the medical profession is built on the human interaction between a doctor and a patient. By offloading repetitive and administrative burdens, AI helps fill the burnout vacuum that has been forcing doctors out of the industry. The core triumph of medical AI is not technological, it is the restoration of the doctor's most valuable commodity, the time to be fully present and heal.